Extina Foam is used to treat seborrheic dermatitis, a skin condition caused by a fungus infecting the skin. This can result in dry, flaky skin on the scalp, face, ears, chest, or upper back. The active ingredient, ketoconazole, is an antifungal drug that stops the growth of the fungus. It is recommended to use Extina Foam daily for the best results. Apply a thin layer to the affected area and leave it on for 10 minutes before rinsing off. It is important to use this medication as directed by your doctor for optimal effectiveness. Before using Extina Foam, make sure to read the patient information leaflet from your pharmacist. If you have any questions, consult your doctor or pharmacist. When using the foam, if the can feels warm or the foam is runny, place the can under cool running water for a few minutes before using. Remember to use this medication only on the skin. Clean and dry the area to be treated before applying the foam. To prevent the medication from melting on your fingers, wash your hands with cold water and dry thoroughly before applying. Hold the can upright and spray the medication into the cap or another clean surface. Then, pick up the medication with your fingertips and gently rub it into the affected areas as directed by your doctor, usually 2 times daily for 4 weeks. If treating the scalp, part your hair and apply the medication directly to the affected scalp area, not the hair. Avoid applying this medication in the eyes, nose, mouth, or inside the vagina. If the medication gets into these areas, flush with plenty of water. Remember to wash your hands after applying the medication and use it regularly at the same times each day to get the most benefit from it. If your condition worsens or does not improve after 4 weeks of treatment, consult your doctor. If you experience burning or irritation at the application site, let your doctor or pharmacist know. It's important to remember that your doctor has prescribed this medication because they believe the benefits outweigh the potential side effects. Most people using this medication do not experience serious side effects. While a serious allergic reaction to this drug is rare, seek medical help immediately if you notice symptoms such as rash, itching or swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice anything else, contact your doctor or pharmacist. As for the best time to take Extina Foam, follow your doctor's instructions for the recommended daily dosage. If you have any concerns or questions about the medication, don't hesitate to reach out to your healthcare provider. Before using Extina Foam, make sure to inform your doctor or pharmacist if you have any allergies to ketoconazole or other azole antifungals. This medication may contain inactive ingredients that could cause allergic reactions or other issues. Be sure to discuss your medical history with your doctor or pharmacist before using Extina Foam. It's important to know that Extina Foam may make you more sensitive to the sun, so it's best to limit your time outdoors and avoid tanning booths and sun lamps while using this medication. Make sure to use sunscreen and wear protective clothing when you are outside. If you experience sunburn or skin blisters/redness, be sure to contact your doctor right away. If you are pregnant, it's important to discuss the risks and benefits of using Extina Foam with your doctor before starting this medication. It's currently unknown if this drug passes into breast milk when applied to the skin, so be sure to consult with your doctor before using this medication while breastfeeding. It's important to be aware of potential drug interactions with Extina Foam, as they may change how your medications work or increase your risk for serious side effects. Be sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. This will help ensure the safe and effective use of Extina Foam. If this medication is swallowed, it can be harmful. If someone takes too much and experiences severe symptoms like fainting or difficulty breathing, it's important to call 911. Otherwise, contact a poison control center immediately. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center for assistance. Remember, this medication should only be used for the specific skin condition it was prescribed for. Do not share it with others or use it for a different skin condition without your doctor's approval. If you need to treat another skin condition, you may need a different medication. If you forget to use Extina Foam, use it as soon as you remember. If it's almost time for your next dose, skip the missed dose and use the next dose at the usual time. Don't use a double dose to make up for the missed one. When you have Extina Foam at home, it's important to store it at room temperature and away from heat. Avoid keeping it in the refrigerator or freezer, as it may affect the product. Also, keep in mind that Extina Foam is flammable, so it's crucial to store it away from any open flames. And of course, always remember to keep all medications out of reach of children and pets for their safety. When it comes to disposing of the product, do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, make sure to properly discard the product when it has expired or is no longer needed. You can consult your pharmacist or local waste disposal company for the correct way to do this. By following these simple guidelines, you can ensure the safe and proper use of Extina Foam in your home. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.